Dr. Gary Bellman, board certified urologist. Evidently, former President Biden was diagnosed with aggressive prostate cancer. How does that happen in 2025? I will tell you most likely how this happens, which is really infuriating to people like myself. It is well-meaning primary doctors, family doctors, other doctors who say, we don't need to screen you anymore for prostate cancer, because most of the time prostate cancer is slow growing, and most of the time you're going to die of something else. And most of the time is not all the time. And I can't tell you how many times aggressive prostate cancer is missed. And how do we screen for it? It's not like screening for a colonoscopy where you have to go to sleep and you have to go under general anesthesia. It's a blood test. So these well-meaning primary doctors are not saying don't do the blood test. They're saying we're not going to do that blood test. So when 80-year-olds go to their family doctors, they check their sugar, they check their cholesterol, they check their thyroid, they put a needle in the vein, but they won't tick off the PSA on the lab. And all that needs to be doing is the little tick on the PSA, and you get the PSA test. I see men a few times a year who have advanced prostate cancer on diagnosis. Generally, they are men who don't go see a doctor and haven't seen a doctor in 20 years, or they see a doctor who has this philosophy that men of a certain age don't need to be screened for prostate cancer. And you don't even need a finger exam. You don't need to have the finger in the backside. Do the blood test. If the blood test is elevated, we do a non-invasive MRI. And a lot of the times it's fine. But get screened, get an annual PSA. Are there false positives? Yes. Are there advanced prostate cancers that don't make PSA? Yes, that's extremely unusual. Most likely, some well-meaning physician for the former president said, oh, if he's a certain age, we don't need to screen for prostate cancer. That means we don't need to tick off the little box of the needle that's going in the vein that would take out a little bit more blood, and then you look at the PSA and probably obviate a situation like this. Most of the time when this happens, someone has some pain in a bone or anemia or weakness, and they go in, they find advanced prostate cancer. Most of the time this is avoidable, and men, get your annual PSA. If your primary doctor says you're too old, or you don't need to be screened, or I don't believe in screening, find another doctor.